And then what we need to know is like there are two types of infusion. One is a concurrent infusion and a sequential infusion. So what happens is concurrent means occurring at the same time. Now already an infusion service is going on with a particular medicine. Now the doctor is going to add some other drug into it. So at the same time of an infusion, if some other drug is being injected, then we would call that as a concurrent infusion. If there is injection of a new drug after the initial service, then this becomes a sequential infusion. Please understand, only hospitals can report the sequential infusion of the same drug separately, but not for professional service. So we've understood two things. One is a concurrent infusion which takes place at the same time of an infusion. There is an addition of a drug. Next is a sequential infusion which happens after the initial service is being done. So here again we have, so for a sequential infusion you can report that as 96367 and a 96368. Now what is an IV push? So an infusion of 15 minutes or less can be taken as an IV push. So if the infusion itself is like 15 minutes, then this automatically becomes an push and not a infusion. Okay, let's see one example where what happens is, now the healthcare provider in a hospital is just giving an IV push of ondansetron 4 mg at 10:30 a.m. and he is also administering ciprofloxacin from 11:25 to 12:30. Now considering the hydration status of this patient, saline was started from 9:50 a.m. till 11 a.m. Can you please figure out the codes here? Here, please find out what would come as a primary service, because we have an infusion here, a push here and an hydration service here. So we already know, based on the hierarchy, the infusion takes priority over the IV push. So let's code the infusion, which is 96365, and this is for the drug ciprofloxacin from 11:25 to 12:30. Okay, so once you determine the infusion code, next we'll have to know the add-on codes for the push. So when you see the board here, you can very well see push has the add-on code 96375 and the hydration service is 96361. So for the ondansetron push, you can give this code 96375, which is an add-on code, and the hydration service also becomes a secondary service. So report with the add-on code 96361. Plus you should also bill for the drugs. In this case, it is Cipro and then ondansetron. You should also take into account the number of units of the drug that should be billed, because ondansetron in a HIPEX manual would be given for only 1 milligram, but the provider here has administered 4 milligram. So you would have to report 4 units of ondansetron of this J code. I hope this gives you a very clear picture, and definitely you can encounter one question from your medical auditing and CPC exam as well.